Good afternoon, everyone. Thanks for attending the Applying to Subspecialty Training webinar. I'm Eloise, the Medical Recruitment Coordinator at the college. We have another couple of presenters with us today. We have James, who is the Head of Medical Recruitment at the college, and also Maria, who is the new trainee recruitment rep. And you'll hear from them a bit later on in the presentation. So the presentation, we've got the webinar for the next hour. So what we're going to cover during the next hour, I'll go through the eligibility criteria for subspecialty training, the key dates, which subspecialties are recruiting in the upcoming round, what happens before you apply, so that's the confirmation of eligibility form needs to be submitted, and then go through the application form, the shortlisting process. We'll touch on the interview outcomes and the offers process. I'll hand over to James to go through the assessment areas, including the shortlisting domains. And then he'll hand over to Maria, who will give a few tips on a successful application. And finally, we'll finish with a Q&A. So you should see, I think at the top of your screen, it will be called Q&A, and please do add your questions as we go through the webinar, and we'll come to those at the end. So the eligibility criteria for subspecialty trainees. It is open for RCPCH trainees. That also includes academic trainees. It's also open to paediatric trainees in the Republic of Ireland, and also the allied specialty trainees from anaesthetics, intensive care medicine, and emergency medicine. So I've just run through the different groups. So this is all on the website as well, and I'll put the link for that, where you'll see the link for that at the end of the presentation. So for the RCPCH trainees, you must have completed all your MRCPCH examinations, and that's by the point of interview. So you should be looking to take your final examination very soon to be able to have your results in time. You must have completed core level training, and that's by the time of entry. You must be on an ARCP outcome 1, and that's at the point of application. You must have enough time to complete subspecialty training before your CCT date. And if you are an academic trainee applying, you should already have an academic clinical lectureship post already lined up. Okay, and we're asked for details on the application form. If you are applying from the Republic of Ireland, you should have completed the equivalent examination, so the MRCPI in paediatrics, and all of your BST general paediatrics mandatory courses, and also demonstrate on a separate form your completion or expected completion of the core training capabilities, and that's by the time of entry. So there's a separate confirmation of eligibility form for ROI trainees. So the title will be the confirmation of eligibility form. Okay, so for anaesthetic, intensive care medicine and emergency medicine trainees, it's different for each allied specialty. So I won't run through all of those in this webinar, but do go over to our website if you haven't had a look, and have a look at the individual eligibility criteria for your specialty. We do not accept applications from trainees from outside of the UK or the Republic of Ireland. So the key dates for the next round, The most important date is the applications are opening 12 noon, Wednesday, 22nd of October. And then the deadline for the confirmation of eligibility forms and the oral application is the same date, same time. So you've got till 12 noon on Wednesday, the 12th of November, and that is a strict deadline. We will not accept late applications or late confirmation of eligibility forms. We'll then have the longlisting and shortlisting process, and then we'll release the shortlisting outcomes and the invitations to interview at the same time from Wednesday, the 17th of December. The interviews are online, so that's next year from the 22nd of January to the 6th of February. And once the interviews have finished, you then have to the following Monday, the 9th of February, to confirm your preference choices. So you can change them around up till then. We'll then make the initial offers on Oriel from Tuesday the 17th of February, and then any posts that haven't been filled will be offered to the trainees that were found appointable in the interview process, and that will be from Friday the 27th of February, so after the offers process. Okay, so you'll only be contacted if your subspecialty is involved. And all of these dates are available on the website. You can see all the subspecialties that will be recruiting in the next round. The only exceptions, it's child mental health, and also actually pharmacology will not be recruiting in the next round, but otherwise all the specialties you see on the screen have posts. And the programs that are available in the next round are available to see on our website in the program directories, and then there's links to the job description. So hopefully you've been able to see that already. So at the moment in part of the process, you should be thinking about your confirmation of eligibility form, getting that filled out and sent to your educational supervisor. So all applicants need to submit a form, whether you're already an RCPCH trainee, allied specialty, or from the Republic of Ireland. So it will form part of the long listing process, but it's not used in shortlisting. So 3 people have to fill it out. So yourself as the applicant, your educational supervisor, and your deanery contact, so the head of school or the TPD. And you can find your contact on our website in the download section. And as I said in the key dates, it must be with us by the application deadline. So it's the applicant's responsibility to make sure the form is with us by that date. So you can find it if you're an RCPCH trainee on ePortfolio, also known as Riser or was Kaizen. And it's available as a download on our website if you're from an allied specialty or from the Republic of Ireland. So I'll just quickly run through where it is on Riser if you haven't found it yet. So you find it like you would find other forms. So you have to create a new event. You'll then find the form, confirmation of eligibility form for subspecialty training. That's the title. It's under the whole timeline. Okay. And then filling it out, just read the instructions. You'll have section 1 to fill out, attach all the required evidence, and I'll come on to that in a bit more detail in a moment. You then submit it to your educational supervisor. They complete section 2 and send it back to you, and then you must send it on to your head of school or TPD. They complete section 4, and then they will submit it to us by the application deadline. But you need to keep track and make sure that they do actually send it to us by the deadline. And then as part of longlisting, once we've reviewed your form, we will then confirm receipt. So we won't confirm receipt as soon as we receive it. It's part of the longlisting process. Okay, so there might be a bit of a delay from when you send it to us and when we actually confirm receipt. Okay, and the deadline is the same for trainees, from applicants from allied specialties or Republic of Ireland. So you need to email it to us by the application deadline. Okay, any late submissions of the form will be long listed out. It doesn't need to be uploaded to your oral application form. And the little asterisks there, the evidence that you need to upload, that also includes, if you are counting any prior experience because you're applying later in your training, you need to make sure you upload your email confirmation from the CSAC chair. So there's some new parts to the form this year. So all applicants are required to write 3 examples of clinical activities and experience from your career to date, and also your most significant quality improvement project or audit to date. So these are also the questions that are on the oral application form. So a few things to note: they must be the same answers that you are putting on your oral application form, so you must think about it very carefully, and it must be the same wording. That's how we're carrying out the checks in longlisting. You must upload evidence from your e-portfolio for each of your examples, and because they must be the same as your oral application form answers, remember the 50-word maximum word count. So RISA, the confirmation of eligibility form, will not stop you from going over, so you must pay attention to the word count, perhaps writing it in words and pasting it back in just to make sure you haven't gone over, so do be careful about that. Sometimes people are wondering, particularly if they're out of program, which educational supervisor should be signing off your form. Generally, it should be your usual educational supervisor when you're not on an OOP, because it should really be the person that knows you best. Okay, so your original educational supervisor, not the person that you're on OOP with. Okay, so what can be used as evidence? So really, there are no restrictions on what we would accept, as long as it is relevant to the example, your educational supervisor has reviewed the evidence, and they think it relates as well. So I've put a few examples there that are on your e-portfolio. So as long as it backs up your example, it's fine. There isn't any restrictions on the date range either. So as long as it is within your training time in paediatrics and it's something you've done, not something that you're going to do, that's fine. So you can write a reflection now or something and upload it to your e-portfolio. That's fine. You don't need to have had experience in the subspecialty to be able to apply. So you can absolutely write about a placement in something else and just focus on the transferable skills. What the shortlisters are looking for is that you understand what it takes to work in the subspecialty. Okay. So the application form is on Oriel. So if you haven't got an account, you can create one in advance. The application window is Wednesday, 22nd of October and closes on Wednesday, 12th of November, 12 noon both times. The application form will ask you for 3 referees, and that will be part of the recruitment checks that the deanery may be carrying out. Be aware of the word count, so you can start preparing your answers in advance So the white space questions are 50 words maximum. You can use bullet points if that kind of works with your answers. The shortlisters won't be marking you down on your grammar or how you've written it. Just be aware that sometimes the formatting, well, there won't be the option to put bullet points in Oriel, so you may need to copy and paste that over from Word or put it through Notebook beforehand. We do take plagiarism very seriously, and if anyone is found to have done this, we'll look at that very severely and contact the deanery and your supervisors. So do be aware of that and make sure that you aren't copying answers from anyone else. Make sure you submit your application at least 48 hours before the closing date, because we do not accept late applications at all. It's a very strict deadline. Once it gets to the time, you will no longer be able to submit your application. So a little bit on the shortlisting process. There'll be, in each panel, there'll be 3 consultants from your subspecialty. The largest subspecialties like neonatal medicine, intensive care, paediatric intensive care medicine, paediatric emergency medicine, and community child health, they split the questions between 2 panels of 3. So each panel will score half the questions for all the applicants. So every shortlister will see every application. It's just the larger subspecialties only see 3 questions each. All the applications are sent to the shortlisting panel anonymously, so they will only be able to see your answers to the shortlisting questions, nothing else. Applicants are ranked according to your shortlisting score. A cut-off score will then be determined for the invites to interview, and that's based on the number of the overall possible appointments, so the number of posts available. So shortlisting outcomes and invites to interview are sent out at the same time from Wednesday the 17th of December, and that's not before 4. In your invitation, you'll have your interview date, and it's on, and you can pick when your time is, but that's on a first come first served basis, and that's through the Oriel system. The interview dates are on the website at the moment, so you can have a look and see when your subspecialty is having their interview. It will also have a bit more on the structure of the interview. The duration is the same for all the interviews. They're all 25 minutes. After the shortlisting process, you are able to see your score in the system. So this just is an example. It shows your dashboard in Oriel. So as you go through the process, each stage it will turn green, and you can just click where it says shortlist, and it will show you your score underneath. So all applicants, whether you're shortlisted or not, you will receive a breakdown of your scores, your overall score, and any comments at the panel left. And so that feedback will be sent out by Monday, 22nd of December. So the shortlisting scores will only be determined who goes to interview, but it's not used in any other part of the process. So a little bit on the interview outcomes. So to be deemed appointable, you must have scored a minimum of 60% or above. So it doesn't guarantee you a post, but it allows you to be open to be in the offers process. It is, however, possible for a candidate who scores 60% or above not to be appointed by the panel if there are serious concerns like patient safety issues that have been raised in the interview process. but there are very thorough wash-ups, so meetings after the interviews at the end of the day with the lay chair and the panel to discuss, and any concerns that have come up will be discussed. So the interview outcomes and the first round of offers are sent out at the same time via Oriel, and that's from Wednesday, the 17th of February. And the offers process usually happens for about a couple of weeks, depending on how many rounds of offers there are. But for the large subspecialties, there may be 2 or 3 rounds, and then there's the clearing round after that. So for the offers process, the applicants the appointable applicants who score 60% or above are given a national ranking, and they may receive an offer based on their ranking and preferences. So obviously, the more preferences that you make, there may be a higher chance you receive one, but we do say only preference the offers that you are able to go to. Okay. So when you receive an offer, if you receive an offer, you will then have 48 hours to decide what to do with the offer. So you can either accept it if it's your first choice. If it's not your first choice, perhaps your second, you may want to accept with upgrade. So if the person who has received your preference declines it, you will then instantly be upgraded to it. We don't suggest holding a post. That is an option, but it's not really applicable for our recruitment, because holding it is essentially not really making a decision. And obviously, once you decline your offer, you will then be out of the round altogether. So really, you'll be looking at accept or accepting with upgrades if it's not quite what you wanted. So if you have received an offer, you will not be able to be in the clearing round. Okay. Okay, so I think at this point, I'm handing over to James to go through the scoring domains.
I think you are. Thank you very much, Eloise. Hi, yes, I'm James Clark. I'm head of medical recruitment. I'm just going to take you through the scoring side of the process, focusing on subspecialty shortlisting, because we will have an interview webinar much closer to the interviews where we'll go into the actual interview setup and questioning in a bit more depth. But you can see the assessments there, areas there. There's 6 for shortlisting and there's 4 interview. Those 4 interview areas, that's 4 separate questions. So you'll have your motivation, clinical ability, academic, and clinical leadership in that part of the process. But in order to get through to the interview, you need to score well on the 6 areas of shortlisting that you can see listed there. And Eloise has obviously already touched on 2, the clinical experience and the QI, because you should be in the process of obviously loading these examples and so on up into your confirmation of eligibility form at the moment. The other 4 sections there, leadership, education, research, publications, presentations, posters. And just to say that obviously you're linking your examples of your clinical evidence and your QI in RISA. The clinical experience in particular, you would expect to be from fairly recent future, certainly the last year, 2 years, really, because this is about your exploration and your preparation for applying. QI and audit as well is something which obviously is fairly standard as part of training, so it should be something which is on your e-portfolio already, unless perhaps you've done that when you've been overseas, in which case you can obviously upload that. You could create a reflection or something like that to upload it. The other 4 sections they are obviously not required for the eligibility form, and also they don't have to be specific to the subspecialty, neither does the QI audit. So they can be from kind of any part in your training going back. Probably as far as foundation, I think it's unlikely probably that people would evidence anything from earlier, but if it is your best example, that might be the case. So just a sort of general rule of thumb there, just to bear in mind that section 1 is the one that has to be linked to the subspecialty really clearly, because that's your exploration and your preparedness. And those are the sort of things that you will have been discussing with your supervisor for them to say, yep, definitely go for it. The other 5 sections there, obviously, if you've got anything that can link to any sort of transferable skills or anything like that, then that's great. But that's not what they're scored on the basis of, and therefore it doesn't have to have been done in the subspecialty that you're moving into. So a little bit more of an in-depth look at the individual sections, otherwise, if you wouldn't mind moving to the next slide. So here's our clinical experience, which we've gone through a bit already. So just to reiterate, because it is slight change this year in that you are going to be using the exact same examples from your RISA confirmation of eligibility form or your confirmation of eligibility if you're from Republic of Ireland or another specialty. So it's just a reminder there, they've got to be 3 clear separate examples. So try not to overlap. It does say at the start of the application form that you should avoid using examples in more than one section, and that obviously applies to this as well. These should be clearly separate examples looking at various sort of activities you may have done, experience you may have gained, and it does obviously have to be from a clinical point of view as well. And it's got the 50-word limits in there, which has already been mentioned briefly, and you will score up to 3 points for each of the 3 examples. So just to note as well that with the clinical evidence and the QI evidence as well, the fact that they've been on your confirmation of eligibility form does not give them the score. So when it does come to shortlisting, this section and the QI section are going to be scored by somebody who's not seen them before. So having those examples that you've agreed with your supervisor and so on in there does not guarantee that you get full points. So just bear that in mind. Okay. But obviously, the better you've been able to prep and the kind of better sort of conversations you've been able to have with your seniors, then the more likely you are to score highly in this. And it doesn't really require anything other than what it says on the tin, essentially. I think Maria's had the opportunity to go through this process with the limited word count, so I know she's going to touch on that shortly after I finish talking about these sections. Let's move on to the next one, please. Is the leadership section. So it's another one which is out of 3. So as with a number of these sections here, one of the clear things that you are going to need to make sure you do is actually explain various bits of it. So it's not good enough just to kind of pay lip service to, I led this or I did that. You've got to explain actually how you led it, what was your responsibility, what was your contribution, what was the time commitment, and so on. So that's just something to be particularly mindful of in sections like this one, where you do have the sort of criteria such as leadership and management and so on and so forth. It can't be I led, I managed. It needs to be I did this as a leadership role, or however you can make it clear enough that that's your responsibility and you're part of that program of activity. And this is all also in the glossary. We've got a very in-depth glossary. So if you don't want to listen to me rabbiting on while you're doing this, you can refer back into the glossary as well, which has a lot of these explanations in there. Let's move on to the next section, which is the QI one. So again, we've spoken about this quite a lot. And this will be the other one that you will have already logged on your RISA form. Just to say that you don't need to upload any other evidence for any of these sections apart from the presentations one at the end. So even though you've had this on the confirmation of eligibility form, you don't have to upload it still to your oral application. The idea is that it's been pre-verified by your supervisor. That's why it's on the confirmation of eligibility form. So there's something there which has got clear evidence that that somebody has been able to say, yep, that's definitely how it went. That's exactly the contribution that you made, and so on and so forth. So it's on the confirmation of eligibility form for that reason, and therefore you don't need to upload stuff. But yeah, just make sure that you kind of follow the wording there and put in as much detail in that sort of short 50 words as you can to meet all the various different criteria. And again, this is another one which is quite key when you're talking about the I designed, I led, I did. You need to be saying exactly how you did design it or what your contribution was to the leadership of it and so on. So that's what we mean by sort of a clear description. And let's move on to the next shortlisting area. Education involvement and teaching. So this is the other one, which is slightly different in that there is a additional bonus point, if you like, on offer. So everyone's scored out of a possible 4, but if you are able to evidence one of the teaching qualifications, that doesn't necessarily guarantee you a 4. So these 2 bits are scored separately. So you get 0 to 3 of actually demonstrating your experience and your involvement in teaching in the past. And then you can add an extra bonus point on if you've done one of the courses that we list in the criteria. So just be aware of that, and don't necessarily, as I expect to get a full mark if you've got the course, because you might not have described everything else so well. So again, it's key just to sort of make sure that you're making it really clear how that was designed, how it was delivered, and so on and so forth, so we can really see what your contribution to the teaching was and what your involvement was. Next section, please. Research experience, again, it's very straightforward, 0 to 3. And just to say, and I know somebody's already asked in the chat, that the research doesn't need to be in your chosen subspecialty or subspecialties. So don't panic if you haven't, because as Eloise said earlier, you don't have to have lots of experience in that subspecialty in order to be able to apply. This is looking at your general research experience and ability. So just make sure that you explain clearly everything again when you're putting your 50-word answers in there, so everyone can see exactly which score you should be attaining. And on to the last section. Yes. So publications, presentations, and posts is the last section. So it's describing your most significant example. And this is the only other section that we've slightly tweaked so that we do need some evidence uploaded to Oriel. So with your application form, we will just need some evidence to support what you've uploaded there. So it's quite a lot of sort of words in the description, but just read them carefully. And we've tried to lay them out in kind of sequential sort of method, so you can see which one your best kind of example relates to, running from obviously nothing or just a single case report or letter lower down to having a first author peer review publication, and that's something other than a case report or letter, and it's not a free open access website, because there is quite a lot in that. There is quite a lot written on that in the glossary section as well. And there's also a section there which says quite clearly what evidence will be accepted to be added to the Oriel application form. So it should be generally in the form of a scan or a screenshot of an email or a letter confirmation of that publication, presentation, and poster. It should show evidence of being sent from an official email account of the hosting body or publisher, not a personal email account. And if it's a scan of the letter, you should be able to see an official letterhead on there. So this is something which you should normally get from anybody if you have submitted any of these sort of things. So it shouldn't hopefully be anything you have to spend a lot of time going searching for. And again, a bit like national recruitment, we only want a single document. We don't want lots of different things to have to sift through. So it needs to be very clear. It just needs to be that confirmation email with all the information. And I'll say that's all detailed there in the final section of the glossary if you're looking at the subspecialty scoring document. Okay. Are there any more slides from here? I think I might be. No, I'm now handing over to Maria. So I know there's a few other questions coming about various different things around evidence and so on. So we will sort of go back over a few of them in the Q&A. But I'll hand over to Maria now, who will tell you what a wonderful experience she had last year applying for subspecialty recruitment.
Hello, everyone. My name is Maria Neocleus. I'm currently a Greek oncology trainee in Southampton. So I was in your shoes this time last year, and I know how stressful this can be. And so I thought I'll put together a few tips just to kind of share my experience and some of my friends' experience as well. And yeah, we'll be happy to take questions at the end as well. So as you have heard already, it's important to start your preparation early. And if you haven't done already, please make sure you start as soon as possible. Unfortunately, it always takes a bit more time than we anticipate. So allowing time at the end for feedback is quite important. So make sure you start putting the answers together as early as you possibly can. We touch upon the kind of best examples to use. And I know it's quite restrictive in that you can only give one example or on your best example. But what I've done, which helped, actually, I had a couple of examples for each of the questions, and then I got people to kind of give me some feedback and sit down and consider which of them would actually get the best scoring. So when you're prepping your answers, that's something perhaps that you would like to consider if you've got senior colleagues who are familiar with the scoring criteria that are currently being used for the application. I think the limitation with the word count can be a bit daunting. It came in the application process last year for the first time, and I was quite apprehensive about it initially, but actually I can tell you that it does save you quite a lot of work. I think we're kind of used to the lengthy paragraphs about our experiences, but actually being able to clearly and succinctly describe what you've gained from this experience is very helpful. And having that word count can actually allow you for that. I know when Louise mentioned that you don't get marked down on your grammatical errors, but I think generally just be mindful that it reads well. And using bullet points is actually a very good avenue. I did use bullet points for some of my answers, and it really helped me narrow down the word count and be quite clear on the attributes or the skills I've gained from the experience that I was describing. One of the pitfalls that some of my colleagues and myself, I think, got into last year was asking for feedback from too many people. And I think that can be quite confusing, especially if it's done closer to the application. I would generally say perhaps 2 senior colleagues, consultants, for example, in your chosen subspecialty, giving you feedback on your application is probably a good number. And considering whether you want a fresh pair of eyes from another subspecialty, perhaps would also be helpful. So try and narrow it down and think ahead which of those people you would like feedback from, as people, going on annual leave and other commitments, with the time constraint on the application, you want to plan in advance for that. One last thing that you could consider is have a look through the syllabus of your chosen subspecialty. I did that before writing down my application. I just think it gives you a bit of an overview of what would be expected of you as a GRE trainee in that subspecialty. So if you start thinking like you're already in that subspecialty, hopefully some of the points you put down in your application would show the people marking your application that you are, a good candidate for that. Of course, this doesn't overtake the scoring criteria, but it just kind of sets the scene, and I think puts your head in the right place when you're writing your application. One last thing that I didn't put down on my slide, but I think it was worth mentioning, is be as specific as you can when you're writing your answers. For example, being quite specific about numbers. If you provided a teaching session, write down how many people were attending your sessions, what kind of region was that in terms of, was it along a couple of district hospitals, or was it over like 10 or 15 hospitals in the region, for example? Just putting things into perspective, because although you may know and the impact of your teaching session, when you're describing it to someone else, using numbers can actually help quantify and give a better picture of the work you've done. So I think that's a little summary from me. I am conscious that we want to leave some time for some questions and answers at the end. And so I will pass on to Eloise at this point, if that's okay.
Thanks, Maria. That was great. So we're now moving on to the Q&A. I think James was saying there's quite a few questions that have come in already, but do keep them coming. So there's the Q&A button, should be at the top of your screen. And yeah, just send through your questions. But on this final slide, you can see a few of the links there. That's our main webpage for subspecialty training. You find all the information and guidance that you need. That's where all those downloadable forms I was talking about as well. And we do have a webpage for all the subspecialties, so you can find that link there, the one in the middle. And if you think of any more questions after today's webinar, then that's our email address there, which you may already know. So I'm just going to hand over to James, who's going to lead on the question Q&A. Thank you.
Thanks, Eloise. And yeah, thanks everyone. Everyone's been sending through a hell of a lot of questions, actually. So we're going to try and get through as many as we can in the next 20 minutes. So let's see how we do. So there's quite a lot of questions coming in about kind of the types of evidence and so on that might be required for the confirmation of eligibility form, particularly when it comes to kind of what sort of physical evidence can be attached and so on and so forth. So I'm going to answer one of these, and I'll also ask Eloise a slightly more technical question as well about uploading stuff via Riser. So essentially, when it comes to the kind of actual evidence examples that you're linking on Riser, development logs, reflections, mini-kex, anything, there's no restrictions at all, basically. As long as it's from your portfolio and backs up your examples, then it's absolutely fine. So this is obviously for the clinical and for the QI. So that also goes for the date range as well. It needs to be within your paediatric training time for that clinical section and QI section, so it can be properly pre-verified. Because I say that's part of it. It's not just making sure that you're sort of making the right sort of decisions when it comes to applying and so on. It's also just making sure that we've got the ability to just do a little bit of pre-verification of some of the information that gets pushed through to the shortlisting stage. So for the items on that confirmation of eligibility form, so really no restrictions, to be honest, just as long as they actually back up what you've written in your example, that's what we're looking for. For the other sections, as I mentioned, they don't have to be linked to the subspecialty. They don't have to be done within training necessarily, but you would expect that probably most examples do come from your training time. And when it comes to uploading evidence to Riser, this is where I was going to defer to your markedly better expertise with Riser, Eloise. How is the best way to do it? Somebody said, can you link them? Can you screenshot them, copy to Word? What's the best way of actually attaching your evidence in ePortfolio?
Yeah, so you won't be able to link to your ePortfolio. You have to download it. So hopefully there's somewhere to download as a PDF or save it as a PDF, and then upload it to your form. Okay, so yeah, that's it basically.
Yeah, so yeah, I think every page has got a PDF downloadable
It should
kind of
do.
option on it.
Yeah.
It should have, yeah. Okay, that's really helpful. Thank you. And actually, just another ePortfolio one, which we might need to take away. I'm not convinced I know the answer off the top of my head, but obviously we've got people who are applying from OOPS and so on and so forth. And certainly one of our attendees has tried to send it to their supervisor and it's gone to their OOPS supervisor. Do you know, is there a way that you can link the form back to your prior supervisor? Let's say if we don't know off the top of our heads, we'll do some research and get training quality to tell us the lowdown. But I don't know if you're able to help with that one, Eloise, at all.
That possibly could be a region, because of the region. If you have moved and you've got a different region on your profile, so that will be something we'll have to check with training services team. So if you can email us directly, that would be great, and then we can take it up with them and see what we can do.
Great, thank you. Okay, so we've touched a little bit on examples and so on. We've also sort of touched around what needs to be specialty specific and so on, which is essentially the clinical examples. Eligibility forms, how many per application? So it's one per application, because obviously your evidence of preparation, clinical preparation and so on needs to be linked to that subspecialty. So if you are applying to two, you will need two forms. Question around regional and national. So Somebody's asked, particularly from the point of view of Wales, whether they are counted as regional and national rules. So it's another bit that's covered in the glossary for shortlisting. So regional level is basically involvement in work across multiple trusts or representative for specific areas of the nation, e.g. North Wales, South East Scotland, etc. And then national level is something that's carried out at sort of representative health board level. So that would be HEIW, NES, NIMTA, HSE, NHSE, and so on and so forth. So there are, within the four nations, there are regions within the four nations, and then there are national boards, and that's how we align those sorts of things. You touched on this earlier, actually, I think, Maria, which is an important thing as well. And it's something that did definitely come from last year as being quite clear. It is really important just to sort of make it clear. You know, if you are doing something perhaps in a kind of region of someone, you know, how are you doing it, what, across 3 trusts? Are you doing it just across your own trust, and so on and so forth? Because that will make a difference, the amount of points that you'll score from that then. And yeah, just to reiterate on that teaching section as well, that bonus point comes separate to the out of 3 for your general involvement in teaching. So you might only score 1 on that, but if you've got the course, then you get the extra point and get 2. So it's not an automatic 4th point. It's depending on what you score in the 2 parts of it. Let's see if there's any others I've written down. Evidence for the presentations and posters again. So I might just defer quickly back to you, Maria, on this as well. But it does need to be something which can clearly identify who it is that you've actually done this work for. And someone's worried that, you know, what if it's not a particularly kind of well-known organisation or something like that? Or, you know, is it possible to provide a list? We can't really provide a list because anything's potentially valid. Is there anything you can add from a sort of trainee point of view on that, Maria?
I'm trying to find the exact question. Can you just read it out? Is that okay?
Yeah, I'm just going to try and find it myself in amongst the... Oh, here we go. Is there a list of recognised organisations for presenting a poster at an international conference? I'm concerned that examples without an active link or citation won't be scored. Since there's no citation or active link for an international oral presentation, will that example not be scored without citation? Can you please clarify?
So I did use an international oral presentation, although at the time when we applied last year, we didn't have to provide the evidence, but you should have essentially your email confirmation telling you that you were a presenter at this international conference, which is what you would normally get, and you can use that as the evidence. That answer the question.
Yeah, I think so. I think, yeah, that citations and so on are not what we're kind of particularly concerned about. This evidence is exactly what you just said, the sort of official email confirmation that you would get from whichever organisation it is that you're presenting or you've written on behalf of. And if you haven't got it still to hand, then I'm sure you can go back and ask them for a quick confirmation that you presented at something. I don't imagine anybody will say, no, unlucky, you should have got the one from the time. So for QI projects, if the most significant project I have been involved in was prior to starting paediatric training, can this be used as an example? Now, obviously, that is something that we've said we need to be able to verify on the ePortfolio. So it really should be something probably a bit more recent. From your experience of doing sort of QI audit, Maria, do you think there should be any reason why that might be the other way around? I suppose the one thing that I'm thinking of is potentially if people have come from an overseas program or something, they might have done it before entering ST3, in which case I think so long as the information can somehow be linked to something on ePortfolio, I think that would still be usable.
Yeah, I completely agree with that.
Yeah, so even if it's not something that's actually been, you know, attached as part of your training, as long as you're able to upload it as perhaps, would that be best as like a reflection, do you think, perhaps, or what would?
Yeah, or a reflection and perhaps like a little report at the end of, almost like an abstract of the work,
Yeah,
like an abstract of the QI, or the audit, rather than just a simple. It's nice. It would be nice to have a little abstract, I think, along with your reflection on that, just to give a bit more information of the work.
yeah, no, that sounds very sensible actually, because we're essentially talking about something that's been done outside of training, so therefore your supervisor wouldn't have even necessarily been around while you were doing it. So I think, yeah, that is probably the sort of bells and whistles approach, definitely. Thank you. Let's see what else we've had come through. A few people have been asking about whether they can use the same examples of last year. I think I posted an answer to one of them. Yeah, there's absolutely nothing to stop using the same examples. If they're still your best examples, then absolutely use them again. Just bear in mind, I think, if you didn't score sort of top marks on any of those sections, just refer to any feedback you might have got, or discuss probably with your supervisor or one of your colleagues as well why it might be that you didn't quite hit the sort of top mark of 3 or whatever it was for it, just so that it may well have been down to the way that you actually evidenced it in the 50 words. But equally, yeah, just be aware that you are being scored independently again by a whole bunch of assessors that don't know who you are. So it's a little bit like the whole bit that I mentioned earlier around the confirmation of eligibility form X examples. They're going to be scored independently by our shortlisting panels after you've submitted your application. So the fact that they're there and they've been through on the confirmation of eligibility is not a confirmation that you've got top marks in them. And that goes the same really for any examples you've got there. I mean, obviously, if they fit the criteria, they should score, but just be very careful. But absolutely no problem in using stuff again. If you are able to access your application from last year, you might have been able to copy and paste it out into Word, which would be helpful, so you don't have to write it all again from scratch. Got a couple of questions around interview scoring. Interview scoring is not due to change this year. In fact, interview questions are not due to change this year. Question domains, that is. So they will be the same, and they will be half an hour interviews. So we're not changing a great deal around the interview format itself. Leadership is another thing which I think we could just re-establish the difference there as well. As somebody's asked about their leadership example on the shortlisting. So there is a subtle difference between the shortlisting and the interview leadership requirements. The leadership requirements in the interview are very much clinical leadership, whereas the leadership in the application form is not. So if I just quote from the shortlisting guidance on the leadership question, it says, describe clearly the most significant leadership or managerial role you have held in your professional life, undergraduate or postgraduate, that you've undertaken since commencing your medical career. This may therefore include roles outside or within your work environment, but importantly should not be a clinical leadership role where you led a clinical situation team. This will be assessed at interview. This was the same last year. I don't know if there's any sort of helpful kind of trainee sort of perspective thoughts you might have on that, Maria, of just sort of understand the difference between the two sections, the sort of examples you use, perhaps.
No, I think that kind of covers it in terms of leadership. So in my actual application, I've used a leadership role I had in a medical society, but it wasn't in a clinical context. And then in your interview, obviously, you're going to be tested on your leadership within the clinical environment. So it's a very different kind of dynamic, although transferable skills, obviously.
Yeah, absolutely. There was a question about non-paediatric trainee evidence as well, i.e. for sort of anaesthesia, ICM, Republic of Ireland applicants. Eloise, I don't know if there's anything else you wanted to add on kind of their form, because obviously theirs isn't going to be on ePortfolio, but it's a similar form the way it's laid out. Is there any more sort of specifics that you're able to give, or just a recap of how that works from a non-paediatric trainee point of view?
So it's really the same, but obviously the evidence just won't be on ePortfolio because you don't have that. But it still needs to be verified by your educational supervisor. So if you do have any specific questions, perhaps you can drop that in the chat or email us. But yeah, essentially it's the same evidence. It just has to be relevant, transferable skills, looking at those types of things, and verified by your educational supervisor.
Thank you. Someone just asking about QUIP and like an ongoing project. Can you reference that? You could, but you're going to limit the amount of points you get because you're going to find it quite difficult probably to evidence any subsequent changes that may have taken place. But if you've got your if you're able to use that to evidence as many of the points as you can, then it's doable. But as I say, just be aware of what the sort of maximum marks are that you're likely to get, which is probably not going to be much past 1, seeing as they all require some sort of level of findings being evidenced. Let's see if we've got anything else coming. I've got a couple of minutes left. Just asking again about the QI and audit and whether it needs to be related to the subspecialty. Just want to try and reiterate again, no. I know I've been jumping a bit from confirmation of eligibility to shortlisting. The only ones that have to be clearly related to your subspecialty are the clinical ones. The rest do not have to be. There's a few quite specific ones here. I'll say this: we're always sort of slightly towing a fine line with some of the things, with people asking, "Oh, will this be evidence be appropriate or not?" Just bear in mind that we can't really sort of give people the answer for a lot of those sort of type questions. We'll give you as much guidance as we can, but we can't really say, yeah, that's definitely going to get you 3 points, because we aren't going to be scoring it, and also we're not clinicians. So just bear in mind, with some of these kind of slightly more specific questions, we might not answer them here. They're the ones that you should probably direct to your supervisors, really, and the people that are helping you with your application. Okay, I think, unless Maria, Eloise, you've noticed anything else in the chat that's hugely different to any things we've touched on so far, I might call it there, because I think we're getting mostly similar questions coming through. A lot of it, I say, is about the kind of evidence publication and for the rise of form and so on and so forth. And I'll just say again, we're really not trying to sort of trick you or catch you out or anything like that. Just do what it says on the glossary, and you'll be fine.
I don't think I've got anything else to add. I'm just scrolling through the questions as well, and there are a couple of specific ones, but one that I think I may be able to give some advice on is one which asks specifically whether epilogues in archives of disease in childhood would be considered as a first author peer review. I can't give the direct answer to that, but my understanding is that epilogues are a bit of a kind of Q&A session after the article. So I am not sure whether they're formally peer reviewed as a scientific article will be. So yes, speak to your supervisor about it, but I am not convinced it would count formally as a peer reviewed publication.
Thank you, that's helpful. I've seen something slightly different just come in. So if I'm applying for CCH and neurodisability, do I need to get CSEC chair approval? So if you're applying for 2 subspecialties, you don't need to. And in fact, it's probably best not to approach the chairs on that. The only reason you would ever need to approach the chair is if you're trying to ask for any sort of prior experience to be counted or to be used when you do enter a training program, i.e. if you're applying sort of later than ST5 and don't have kind of the indicative time remaining, that's really the only time that you'll be sort of expected to contact the CSAC chair. Most of these guys are involved in the recruitment process as well, so they do have to try and keep quite an objective hat on most of the time. But certainly you don't need to ask permission or anything like that if you want to apply to 2 different subspecialties, particularly 2 that are so closely linked as CCH and neurodisability. I will just round off, because there's been a couple of sort of questions about sort of things changing and so on and so forth. We're aware that obviously there's been a few tweaks this year again, but we've tried to keep it minimal this year, because we did make relatively large sort of changes to kind of particularly the kind of process side of things last year. We are kind of on a bit of a sort of a journey of just trying to refine all this. So things are changing, but we're trying to keep the scoring areas basically the same. So even if there's a different way of demonstrating it or evidencing it, we are not planning to be adding in completely different things. If anything, we're trying to just refine the amount of kind of extracurricular stuff that someone should be expected to do if they're actually going in for subspecialty, and try and make it as tailored as possible, as opposed to just trying to get the biggest CV in the world. So just want to reassure you, we're not looking to keep making gigantic changes, but you know, we do look at feedback, and we do look at the stats and so on every year. So we're always looking to quality improve as much as anything else. So I don't know if there's anything else that you'd like to add at all, Eloise, before we wrap up.
I was just trying to have a look through the chat. I'm not sure if you spoke about this, but defining professional life. I mean, what we mean is during your medical career. So since you've started your medical training, so that can be before paediatrics. But it's not outside of medicine. So during your professional medical training, your medical life. But that was all really I wanted to say. I think we've covered most of them. But as I said, if there's any questions you still have, do send them to our subspecialty email address.